Everyone can see one diagnosis.
Neural
There
tube
is something pathology in my spinal cord.
Neural tube.
Neural tube, excellent. Neural tube defects. What are the causes of neural tube defects?
Folic acid
Folic
deficiency.
acid deficiency. Suppose a pregnant woman has his previous history of NTD in the first child. What will you do? And suppose the first case one is NTD with previous history, and normal second case is a normal term pregnancy of a primate. What is the differences in what are the prophylactic measures will you take in these two scenarios? Now you only
Folic acid.
folic acid is mandatory for both. In the first case, is born, then they are planning for second pregnancy. What will you guide them? First case already baby born with NTD and they are planning for second pregnancy. What will you guide in the first case?
Folic acid
Before the conception, before both male and partner are conceiving or mating each other, before that only the folic acid has to be started. And dose of the folic acid you read and tell. Okay? Read and tell. Normally it is 400 mcg. So normal. So in a normal trimester for a primate, we will start folic acid from which semester?
second first day.
First semester. Iron tablets from second semester. Why?
Metallic taste, nausea and vomiting.
Teratogen.
So already not teratogen.
Metallic taste,
Vomiting.
nausea and vomiting causes.
If you give iron, what affects more? Already pregnant woman has
HCG.
HCG induces
Nausea and
vomiting.
vomiting.
So why HCG induce vomiting? Why? Generally, if we take over sweet, if my tummy is 5 liters and if I take 10 liters of food, what will happen? In pregnancy also same thing happens. HCG will be abnormally increased. It causes nauseating feeling for the pregnant woman in the first trimester. So iron tablets will be starting from second trimester. From day one of the pregnancy, we will start with folic acid supplemented. Previous history of NTD, then before conception. So if you have any problem with my language, also tell me and interrupt me. I don't know Bengali and I can't tell in Bengali. I'm sorry for that. Okay. If in English also, if you want to repeat it me, I'll tell it in second time. Okay. So marasmus, M for monkey. So similar features of monkey, but the monkey is hyperactive, the baby is not hyperactive, the baby is lethargic. So what are the clinical features of
At first we
wasting, thinning of hair?
at first we directly can tell this is a marasmus or
Whereas by seeing the photo is there
or
already.
we can
So protein energy malnutrition. Protein energy. What is the cause? Is protein energy malnutrition. By seeing the figure, you can differentiate between a what is the diet? Here the question is
the probable diagnosis.
probable diagnosis. You can say protein energy malnutrition and marasmus, no problem. Because these questions are 5 marks, so each one will get one question pakka. You have to write on a paper, so no one can judge you. So whatever you know, you write correctly, so your 5 marks will be in your pocket only. Suppose if it is on Viva, they will ask for many things. So here we are concise to only 2 questions. If you write these 2 questions, you will get 5 marks. One chart will be there, this chart will be there, one growth chart will be there. 2 questions will be there, pakka. So 5 marks are in your pocket. Remaining marks you have to get on your own by giving Viva. Okay? Now here, what are the clinical features you have got to perfectly, what is the clinical features of marasmus? Thinning, wasting of muscles, baby is lethargic, leather panty bag appearance, okay? Glossitis around lip infections will be there, all skin will be, the baby looks dehydrated, sunken eyes,
Central obesity.
central obesity for kwashiorkor. Marasmus, can you see the central obesity?
Sir, SRT हो क्या?
No. For kwashiorkor will be sick gross ascites. It may be or may not be there, but it is not a major feature for marasmus. Okay. So now vitamin A. What is the role of vitamin A in our body?
Cell
To prevent blindness, right? It's the only role. Vitamin A prevents blindness and it supplies carotene to our body. Okay? It helps in vision.
It's also a role
In
epithelium?
Epithelium and in also hair color also. Okay, keratin. So what are the doses of vitamin A according to your now IAP scheduler and NIH scheduler?
Less than 6 months.
Less than 650 lakh international units orally, up to 1 year 1 lakh international units orally, if above 1 lakh above 1 year 2 lakh international units orally. When will you injectable forms of vitamin A? When we can give? Only one case. Bronchopulmonary dysplasia. Dysplasia. Vitamin A injection. Okay. Now, this is a rash on a baby on burn on day 2 of life. Just normal rash. It is erythema toxima. Nothing to, no intervention required. Just conceal the measure. It can resolve on its own. That's it. Okay. Clear? Shall I go into next one?
Just rash.
That's erythema toxima. Now, can you differentiate between marasmus and kwashiorkor? So for kwashiorkor, it is also protein calorie malnutrition. Kwashiorkor, central obesity, and all the clinical features. Gross ascites, abdominal distension.
Macrocephaly.
That is microcephaly. Hydrocephaly. So it is very important. Hydrocephaly. Everyone will ask in your Viva also. It is very, 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 very important. Hydrocephaly. Okay, very, very, very important. What are the causes now? Flow of CSF. Can anyone tell me flow of CSF? Flow of CSF. First directly to fourth.
lateral.
Second ventricle. Two lateral ventricles.
Lateral
From
ventricle.
lateral
The
ventricle.
interventricular foramina of Monro. Foramina Luschka.
From that to third ventricle, from third ventricle to cerebral aqueduct,
Sylvius.
to aqueduct
Fourth
Sylvius to
ventricle.
fourth ventricle, from fourth ventricle to sixth. It will flow. Origin from choroid plexus of eye, choroid plexus and choroid plexus only, no? Origin from choroid plexus, and it will flow into cavernous sinus. Explain this flow. So what are the causes of hydrocephalus?
Increase CSF.
So increase CSF fluid or decrease
Decrease
absorption.
absorption.
Or
Brain
hydrocephalus can be two types. One more thing is communicating hydrocephalus and
Obstructive.
or communicating or non-communicating. That is only obstructive. Clear? Communicating means there is a channel between everything. Non-communicative or obstructive. What are the causes? Now you have to see it very perfectly. Go today and read it. Okay? Go today and read it. Today only complete all these things. And one more thing. Some other causes like AV malformations, arteriovenous malformations, and one more is Arnold-Chenrich syndrome. Right? Arnold-Chenrich syndrome. These are the causes. Dandy-Walker syndrome.
And Walker.
Arnold-Cherry syndrome. Arnold-Cherry, Dandy-Walker, AV malformations. That is distended colon. Colon can you see below the what do you see? A fundic gas shadow or air bubble?
Single
What is it? Single bubble. Where will you see single bubble signs? CHPS, congenital hyperpyrrolic species. Okay? Where will you see in double bubble signs? This is very important for
Duodenal
your
atresia.
surgery. Double bubble sign, excellent. Duodenal atresia. Where you will see triple bubble sign?
Jejunal atresia.
Excellent. So if stomach, after stomach there is duodenum, after duodenum there is jejunum. After jejunum there is ileum. Okay. So if there is only single bubble obstruction or single bubble sign seen on an or X-ray, then it is CHPS. What is the history of CHPS?
Nonbullous vomiting.
Non-bilious. Non-bilious vomiting, because the obstruction is present above the pylori. If it is in the D2, it is there. If it is in the obstruction is in the D2, then you will be seeing bilious vomiting. What is meant by bilious? Bile. Because bile from the common bile duct and the pancreatic ducts opens at region of D1 to D2, between D1 and D2. So CHPS. In CHPS, what is the surgery? Projectile vomiting along with non-bilious vomiting. Non-bilious vomiting. Projectile, non-bilious. So what are the clinical features of CHPS? Paradoxical aciduria due to loss of H plus and so paradoxical aciduria outside. So baby is suffering with metabolic alkalosis. That's it, right? metabolic H plus will be going out, pH will be increased. So baby is with metabolic at alkalosis. Am I correct? When H2O is going out, he will be vomiting. So H plus ions in the body will be reduced. So H plus reduces means it is I.
Alkalosis.
Alkalosis. Metabolic alkalosis.
Kidney tries to compensate that.
If we trying to compensate that compensatory
Respiratory.
metabolic acidosis, respiratory acidosis. Main pathology in CHPS is metabolic alkalosis due to loss of H plus ions. Thalassemia. What you see? Hair and end appearance. Hair and end appearance. Okay. Next one.
Diaphragmatic hernia.
Diaphragmatic hernia. Already in the X-rays now only covered diaphragmatic hernia. So what should we do for the diaphragmatic hernia? What is contraindicated?
Bag and mask.
Bag and mask spasm. Because it causes more air in the body. It causes along with pneumoperitoneum it also causes along with pneumothorax it also causes pneumoperitoneum. So generally it is avoided and patient has to be intubated as early as possible and patient has to be done surgery as early as possible. Can you please skip next one? Two lungs with pipe.
ARDS.
Acute respiratory distress syndrome. Why? Why AR? Can you see an ET tube in the? Yes. Then what are these ones? This one. This is ECG lead. When a patient is intubated, we can't check. We will be checking his heart rate by ECG leads only, respiratory rate and that heart rate. So this is my ET tube. This is my ET tube. Patient has been intubated. Why patient has been intubated? A 27-year-old premature preterm baby.
Preterm.
A 27-year-old female with 27 weeks of gestational age delivered a baby. Then what will be this condition? 27 weeks baby has been delivered and baby is in front of you. Baby will not cry immediately. Okay. Now what will you do? Why baby is not crying immediately?
Lung surfactant is
Because his lungs are immature.
lungs are immature.
Why lungs are immature?
Surfactant.
What is the composition of surfactant?
Phosphatidylcholine.
Phosphatidylcholine. From where is surfactant is produced?
Type 2 pneumocystis.
Type 2 pneumocystis. So normally by what time lungs will be matured? Surfactants 34 weeks. So any baby before delivery of 34 weeks, so we will give induced corticosteroids to mother. We will give corticosteroids to mother. There is a regime, no DEXA regime. Dexamethasone. So we will use dexamethasone doses. Okay, 4 doses every 6 hours. Okay. Next one. So vaccines already you are told right now. All the 4 are vaccines. MMR, DPT, hepatitis B, Rota, BC. Vaccines ma'am told no.